I would now like to invite the District Medical Officer for Region 4 Georgetown Central, Dr. Judy Bentley Brown, who will give you the welcome remarks and introduction. Dr. Judy?
Good morning, everyone. Thank you, Medics Booty. The Bible says to give honor where honor is due. And I would like to acknowledge the presence of our dear Minister of Health, Dr. Frank Anthony, our Director General of the Ministry of Health, Dr. Vishwa Mahadio. I would like to acknowledge all of our special invitees, members of the media, all. Thank you so much. It's such a pleasure to have you all sitting here to celebrate the opening of the new Northeast La Penitence Health Center. The Northeast La Penitence Health Center is once awaiting. It has been a long time awaiting. And it's such a privilege to stand here today. It's not just a building, just like any other health center, but we aim and we strive to provide healthcare system to the persons. We want to make healthcare accessible. We want to give compassionate healthcare because we have compassionate nurses, and we want to provide the highest quality of healthcare that Guyana can provide. The Northeast La Penitence Health Center caters to approximately 7,651 individuals, and these individuals are within 3,472 households. The extension or the boundaries of Northeast La Penitence, it's all the way from East Rockville way to Lamaha Park and beyond. You heard that, nurses? You have to look at persons beyond Lamaha Park, right? So I just want to extend once again, thank you to our Minister, our Director General, for helping us and making today possible. And for all of you guys who would have transformed this health center. Thank you all.
Thank you to our DMO for taking us through a little bit of what Northeast Health Center represents and the catchment area that it caters to. To continue, we'll invite one of Guyana's very own. He's an artist in his own right. He is well known, and more importantly, he's the reigning soca monarch of Guyana. So let's put our hands together as we welcome Mr. Calvin Burnett.
Oh, beautiful Guyana, oh, my lovely native land, more dear to me than all the world. I see what's sun-kissed land, or down upon the borders, looking out upon the deep, the great Atlantic blowing to a fury. All asleep at morn, at noon, or better in the crimson sunset's glow. I love thee, oh, I love thee. Oh, beautiful Guyana, oh, my lovely native land, more dear to me than all the world. I see what sun-kissed strand, or down upon the borders, looking out upon the deep, the great Atlantic blowing to a fury. For asleep at morn, at noon, or better in the crimson sunset's glow. I love thee, oh, Oh, I love
That was beautifully done. So thank you, Mr. Burnett. You represented as always. At this point in time, I'd like to invite the Director General of Ministry to come and give his brief remarks. Let's make him feel welcome.
And Calvin, I remember in 2010 when we had at the Berbice Regional Health Authority our award ceremony. I must say you have come a very far way. In those days, Dr. Frank Anthony was our Executive Director of the Health Sector Development Unit and in actual fact the head of the Regional Health Authority. Congratulations. Keep up the good work, Berbice. Honorable Minister of Health, CMO, Ms. Sheila Verasamy, Member of Parliament and head of the facility here, colleagues all, I'm proud to stand today alongside our Honorable Minister and CMO and to say, Minister, job well done. The last time this facility had any proper work done on it, and I say proper meaning to facilitate some additional better conditions for patients, for visitors, clients, was around 2012, 2013. Am I right, Medics Howard? I think she was a big thing then. Now she's even bigger as our Chief Medics, and Mr. Gavaya, the current Acting Director of Regional Health Services. I'd also like to acknowledge our counselors and to let you know that we are doing our best to serve all citizens of Guyana, including the citizens in your ward. And we therefore expect you to cooperate and work with us, because some of the services that we will be offering will be relatively new. Under this government, we have been instructed, and the Minister ensures that he reminds us every so often, that it is not just another day. It is not just business as usual. Things that we are supposed to do and that our citizens are entitled to, they must get it. We must know the health status of every single citizen in Guyana. Every single citizen must be entitled to the same level of care. And so if we are building facilities in other regions, and if we are improving facilities in other regions, we must do the same for Georgetown. Although these facilities have been neglected by the town council. So the Honorable Minister made a decision that we are not going to just let it fall apart. We are going to improve it. And we have been staffing it, and this facility will be having 2 GMOs, government medical officers, 2 midwives, 1 nursing assistant, as a patient care assistant, a pharmacy assistant, and clinic attendant. It is also going to work closely with the shelter, and it is going to work within the community. Dr. Bentley, as the head for the facilities, the health facilities in Georgetown, was tasked by the Ministry of Health to ensure that we are not only going to wait for patients to come to us, we are going to go house to house and we are going to check on the health status. We are going to provide maternal and child health care. We are going to provide elderly care. We are going to provide men's health. And these are some of the new things. I hope Minister is going to talk about it. But these are some of the new things that you'll be getting in this facility. The Minister of Health, he's my friend, he's my colleague, he's my comrade. But he came through the system. He came through the system, worked as a junior doctor in the system, then worked as a manager in the system, then worked as an executive director, and now he's working as the Minister of Health. And so he knows what are the challenges. He knows what are the issues. Like our president and vice president, he has walked the ground across the country. And only those who have walked the ground, not driving around in a vehicle and all of that. Sometimes we sit and we talk and he tell me how many days he spent in Region 1 and Region 9 and Region 8. Those far out regions. Let's not talk about the coast alone. So when you walk the ground, you know what it is that is there, and you know what it is you want to make happen. And you know what is necessary to raise the standards so that people could achieve care across the country. And I'll tell you the key word under this minister's watch is world-class health care. That we are not going to provide a health care that is second to anyone. We must provide a health care that people from other countries would want to come to us. I could tell you just one example. Sometime around 2009, 2010, we had opened up the National Ophthalmology Hospital in Guyana. When that facility was set up, we had patients coming from across the Caribbean and even from the States and Canada. Guyanese who lived there from the diaspora would come here to get their eyes checked and surgeries done. In 2015, it was closed to surgeries. Patients used to visit, but they couldn't get any surgeries. You know when it was reopened? It was reopened in 2021 under this minister's watch. After the Ministry of Health would have invested over $200 million in equipment, in cleaning the place, in building it back, it was closed, so you had mold and fungus and all these things in the facility. That's how healthcare was run prior to this minister. Spend the money, and I can tell you right now, there is no backlog of cataracts in Guyana. We would have brought out patients from the hinterland region, get their surgeries done here, and take them back in from Region 2, Region 3, 4, 5, 7, 8, 9, 10. So that is how the Ministry of Health is functioning with this government and under this minister's watch. And I'd like to say thank you, Minister, and to take the privilege of saying this facility is not going to disappoint you. Thank you, colleagues.
It was Elaine Russell who said, "A child shall lead them." With these words, I want to invite Miss Heavenly Joy Brown, who's going to bring us a poem. Heavenly.
Good morning, everyone. May you please stand up? And may you please run in this way? You may have your seats. My poem is entitled Keep Fit. If you want to keep fit, why not go for a run? Try skipping with a rope. That can be a lot of fun. And don't forget dancing. That's also good for you. Then of course there is swimming. You could also try that too. You might want to do a bit of running on the spot and try a few star jumps, or maybe quite a lot. You could try bending over so your fingers touch your toes, or kick your legs up so your knees almost touch your nose. You could play a game of football. In fact, I think you should. And a quick game of tennis would really do you good. Just walking at a fast pace will really help you keep fit. Cause you'll never stay healthy if all you do is sit. By Jillian Harper.
At this point in time, we'd like to invite Councillor Mr. Alfonso de Armas to bring his brief remarks.
Distinguished guests, I stand on all protocols observed. Minister, Chief Medical Officer, welcome. My name is Alfonso de Armas, and I am one of the city councillors. And today I'm here really happy, grateful to see that this has been refurbished, remodeled, redone to bring Guyana, to continue to bring this PPP government's work of moving Guyana into the future. And so today we're not just opening a transformed health center, but we're witnessing the tangible results of visionary leadership. Something as small as a local community health center, yes, it is part of the results of visionary leadership. These are the kinds of things that are often overlooked. So visionary leadership and sound governance. This project, like so many others across our country, is a shining example of what the PPP government, under the astute guidance of President Irfan Ali, and in the health sector, Minister Frank Anthony, is delivering for the people of Guyana. You see, healthcare is more than just medicine and hospitals and buildings. It's about people. It's about quality of life. And what happens when we improve healthcare? We're doing a lot more than saving lives. We're creating stronger families, more resilient communities, and a healthier workforce. So let me break it down. When you walk into a health center like this one, that's wheelchair accessible, that's patient friendly, and that's staffed by competent, experienced professionals in a safe and modern environment, you're not just receiving care, you're experiencing respect. You're seeing your government say to you, you matter. And that's what this transformation is about. But let's also take a moment and zoom out and see the bigger picture. You see, under the PPP government, Guyana isn't just changing, it's transforming at a very rapid rate. Investments in healthcare like this facility are part of a larger plan to build a Guyana where our people can thrive. Because good healthcare doesn't just improve lives, it powers economies. A healthy citizen is a productive citizen. A healthy family means children in schools, parents at jobs, and communities that prosper. Just a few days ago, I was in conversation with Miss Patricia Chase Green, our former mayor, and also our representative on council for this area. Can you imagine? We were talking about the state of our community health centers. Can you imagine if the state of our community health centers, what they would be like if they had been left under the control of the city council, who, for whatever matters, has been unable to really bring them about a modern place that is representative of a new One Guyana. And so, thankfully, the Ministry of Health has stepped in and really has taken over not just this one, but a lot of the health centers around Georgetown, supporting those health centers with staff, with medicine, with doctors, etc. Without the support of central government and the Ministry of Health, none of these health centers would be able to offer the expert, professional, courteous service, life-saving service that they offer. And so, again, I want to say to Minister Frank Anthony, we're deeply grateful from the City Council for the level of support that you provide our health centers. This is the kind of leadership that we need, politics aside, and it's exactly what this government has been delivering. Whether it's through the massive infrastructure projects that we're seeing, job creation, or making world-class healthcare accessible, this government has proven that it's not afraid to dream big and to work hard. They're building a Guyana that we've always envisioned, that I've always envisioned growing up here, a country where success isn't just for the few, but for everyone. And so here we are today, standing in the middle of progress. It's not just the building, it's literal progress. This healthcare is not just bricks and mortar, it's a symbol of what happens when good governance meets bold vision. And so today, again, I want to say thank you and congratulations to everybody that worked so hard together to put this together. I look forward to hearing the stories of the countless lives that will be saved, that will be transformed, because now they have access to modern primary health care. So thank you, everyone.
So here we are under the stars as we dream about this El Dorado's gold. And truth be told, there's a fire in my soul, one that burns so bright it cannot be controlled. Welcome to this place that I call home, El Dorado, where the sun kisses your soul. place of natural beauty. From sea to shining sea, the myth's been told. This is Colorado's gold. When legends spoke of a hidden place where fortune lies and explorers chase. But what we found, though this might be true, the greatest treasure in El Dorado is me and you. Oh, El Dorado, where the sun kisses your soul. El Dorado, a place of natural beauty. From sea to shining sea, the myth's been told. This is El Dorado's gold. The pride and the principles, so dear we each do hold, has molded great character. That's where it's waiting gold. So let's strive to guard this hidden treasure the world is yet to see. Welcome to this place that I call home. El Dorado, where the sun kisses your soul. El Dorado, a place of natural beauty. From sea to shining sea, the myth's been told. This is El Dorado's gold. The myth's been told. This is El Dorado's gold. The myth's been told. This is El Dorado's gold.
Thank you very much, Madam Woody. The councillors of the Georgetown City Council, my good friend, is Patricia Chase Green. I've known her for quite a while. And for those of you who don't know, she used to coordinate the Calypso. I think she still does, right? Councillor Copeland, Councillor Jacobs, Councillor Alfonso. We're all so pleased that you're here. And of course, the staff of the Ministry of Health, Director General, Dr. Mahadev, Dr. Singh, our Chief Medical Officer, Dr. Bentley, the District Medical Officer, and all the staff who are here. We're very pleased that we're at this moment where we can open this facility or reopen this facility. As you heard from Dr. Mahadev, this was one of the facilities in the city that was here and it needed quite a lot of repairs. And so the ministry would have put the money in to make sure that we could get this facility upgraded. We currently, of the several facilities that are in the city, the Ministry of Health, we are currently operating 8 of those facilities, this one included. I think the city right now, they have some minimal services being extended at Darty Bailey. But outside of those minimal services, not much else has happened. But we are pleased to step in and to offer these services because we feel strongly that the citizens of Georgetown, they need to also benefit from primary healthcare services, and that is what these health centers offer. So we have been able to improve what we are doing at the primary healthcare level. And over the last maybe 3-4 years, we have worked with the Pan American Health Organization to decide what would be a basic package at the level of a health center. What are the services that we should provide at the level of a health center. And we came up with a package of 115 different interventions. And that's what we aim to provide at all our facilities across Guyana. Now, what does these services include? So we want to look at the continuum. If we think about an age continuum, starting from when children are born, as they grow up, and then you get into adulthood, and then you get into old age, that we must be able to offer this continuum of service. So for children, we see ourselves offering services such as vaccination, because that is very important. And we want to make sure that every child that we have in our country, that they benefit from these vaccines, because vaccines do prevent a lot of childhood illnesses. We in the ministry, we are offering close to 19 antigens. And if the children, they get their vaccines on time, it would prevent them from getting a lot of illnesses. And that's why one of our cardinal programs within the ministry is to push to make sure that every child has been vaccinated. And we will continue to do so. And this particular facility would help us to reach out to this catchment area of children. In addition to the vaccines that we normally offer, which I would say is the traditional vaccines that we offer, over the last 2 years or so, we have placed a lot of emphasis on children between the ages of 9 to 15 getting an HPV vaccine. And why that is important is that because we are seeing among women in Guyana that cervical cancer is the #2 cancer among women in Guyana. But if you're able to get an HPV vaccine during the ages of 9 to 15, then you can prevent cervical cancer from happening. Cervical cancer is caused by the human papillomavirus, and if you take the vaccine, you'll prevent it from happening. And so we want to make sure that children between 9 to 15, they get this vaccine. Now, we are offering it to both sexes, not just for females, but we want the males to also get the vaccine. And some might say, well, if it's preventing cervical cancer, why should male take the vaccine? But we have also seen that there are certain types of cancers that can be prevented in males. And that include penile cancer and anorectal cancers. And that is why we are also offering it to males. So for both sexes, we want to make sure that they take the vaccine. And I've noticed that because we have intensified our work, that more and more children are coming forward and getting the vaccine. And that's a positive thing. But we are not where we would like to be. The WHO recommendation is that at least 90% of our population between the ages of 9 to 15 should be able to get that vaccine. Right now, we are around maybe 40 to 50%. In some regions, it's more than others. But on average, we are somewhere between 40 to 50%. And while that represents an increase from where we were at 15%, we still have somewhere to go. And that's why I think that health centers such as this, and once we're offering the program here, and people come and get the vaccines, that it is going to improve our coverage, not just in Georgetown, but help us to improve that coverage across the country. Now, because it's such a big player in cervical cancer, we have also followed the American guidelines, and we are now offering HPV to women who might be sexually active. So anybody between 16 to 45 can also get this vaccine. And these are the latest recommendations, guidelines, And we have put them in our guidelines, and we are making sure that they can be offered to our population as well. And that's one of the services that you'll have at this facility. But coming back to the children, one of the other programs that we've introduced about a year and a half ago is to be able to screen school children. And we have started at the nursery level, and we wanted to make sure that every child at nursery are able to get a screen done, a medical checkup done. And what does that entail? We want to check their hearing to make sure that they're hearing well. And if we detect that there's a problem, and that can be corrected by a hearing aid, then we will be able to give them a pair of hearing aids. If we also do screening for their eyes, and if they have a problem and that can be corrected by spectacles, then the ministry will provide those spectacles to these children. And we are also doing dental checkups for them. And again, if they have any problems, then we will be able to fix those problems for them. But apart from that, we are doing a general checkup. And that includes looking at their body weight, listening to their lung, seeing if they have any problems. And whatever problems we find, we are working to correct them. So far for nursery school children across the country, we would have screened close to 20,000 children. And for primary school children, we have screened approximately 18,000 children. So these programs, while we go into schools and do that type of screening, we are also making sure that at the health center, that we can offer this type of screening for children within the particular community. And we hope that parents would take advantage of this, because if we detect things early, we can correct it and make sure that it's not a problem. So that's for our children. And this year, we want to focus on not just nursery and primary, but we want to extend and make sure that we cover more primary school children, but also start at the secondary level. And for each of these age categories, the screening tool is different. The things that we look for is a little bit different. But this program is going to continue. Now, the other thing that we are doing is also working to prevent some of the infectious diseases and also chronic non-communicable diseases. We have a problem in our country with the chronic non-communicable diseases. So as people get a little bit older, and I really like that poem, young lady, very good, appropriate poem. As people get older, they're not exercising. And what we see is that people would end up with a lot of chronic diseases. So we are seeing at an early age, people are having diabetes, heart problems, high blood pressure. And if these are not controlled, then they will end up with a lot of complications from these conditions. The Ministry for High Blood Pressure, we have introduced a new program that is called HEARTS, where we are giving medication that is more effective, so we can have better control of your high blood pressure. And if someone's blood pressure is not properly controlled, then that can lead to a stroke. And we don't want people to have strokes in our country. So the new types of medication that we're offering, we want to make sure that people come and get the medication. This health center, we will also make this a health center where HEARTS is being done, meaning that all of this effective medication would be offered to our patients here. Similarly, we have introduced new guidelines in terms of diabetes, and among the things that we are doing is a blood test called HbA1c. This blood test is used to check to see whether someone is diabetic and whether their blood sugar has been up over the last 3 months. Now think about this, just a couple of years ago, this was only being offered in the hospital. Now we have close to 89 sites across the country where HbA1c is the standard of practice. And we are going to continue this year to extend that to make sure that these tests are available, because they're very important if we are going to manage people with diabetes. So we're working to make sure that we have better control of the chronic diseases that are affecting our population, and we want to make sure that at all our health centers you can come to them and get that type of service. The quality will be improved and you'll be able to get that type of service. And only when you develop maybe a complication, then you'll have to be referred to one of our hospitals. And those we are also upgrading. So for infectious diseases too, we have a focus on that. And I know a lot of people these days, when they get a little bit of fever and so forth, they put it down to influenza, right? But it might be some other virus that is circulating. But if we don't come in and get a test done, we'll never know what you're being affected with. Fortunately, most of these viruses, they are not fatal, and so people would live. But there are cases where people, even with influenza, can end up with complications. So if you have any doubt about your condition, please come and get yourself checked here. And I'm sure the staff here would be able to take off a lab sample and send it to our National Public Health Reference Lab. As of last year, we have been working with the Pan American Health Organization, and we now have a section of the National Public Health Reference Lab where we can test for various types of viruses. And we have also been accredited by PAHO as one of the sites in the Caribbean where these types of tests can be done. And every year, they will take samples of these viruses to make next year's vaccines. And last year, they actually took a sample from Guyana to start using that to make this year's influenza vaccine. So we are part of this network. We have the capability now of being able to distinguish what viruses are circulating. And at our health centers, when you do the tests, these things can be sent to the lab and they'll be able to tell you. So there's lots of networking that is being done. So you would see us not just in terms of the infrastructure, but you will see us improve the quality of the programs that we are offering. And we want people to take advantage of these programs. In addition to all of this that I'm telling you, you would see a lot of improvement in terms of some of the facilities that you have in the city. In Festival City, we are adding a new X-ray there, and there'll be a lot of other facilities going there. As you know, that facility is being managed now by the Georgetown Public Hospital. And since we have opened it, it has been managed by them, and we've been constantly improving the services that we offer at Festival City. Not far from here, at Campbellville, some mornings I pass there and I can see people on the bridge standing out there because the facilities were old, and over the years we have added bits and pieces to it, and so it's not the best facility that you can have. And sometimes when it rains, it's very problematic because things are leaking, and you know, it's not a modern facility, let's put it that way. The government recognized this, and so last year we made an award of close to $830 million so that we can do back completely the Campbellville facility. And when that is completed, it will serve both the communities of Campbellville and Kitty, because the Kitty Health Center is also in a deplorable state. And so we want to have a modern facility that can serve these two communities. Now, because of space constraint, we have actually brokered a deal with the post office that is next to Campbellville. And so we will be taking over part of that site so that we can build a nice big facility. And then we'll set aside an area where the post office will operate in this new building that we are building. So you'll have a combination of post office plus a modern health facility that would provide lots of services to the people in that community. So there are lots of good things that are happening where we'll be enhancing facilities. And while we are opening this one today, there are a couple more that we have been working on and fixing up and rehabilitating, and in some cases building back completely. And maybe later in the year, we'll have an opportunity to come back and open some of those. So with those words, I want to once again thank everyone who has worked on this. And I want to say to the staff that we expect that this facility would be giving good service to the community. And because you are near to the ministry, we'll have constant oversight to make sure that the quality that you're delivering is good quality and that its citizens in this community can benefit from all of the services that the ministry is offering. Today when we walk through, you wouldn't see the dental setup, but that's something that we'll be putting in. So there'll be a dental chair here, and with that dental chair, we would also be able to provide some dental services here. So people who need to do their cleaning and all those basic things, they don't have to go down to the Chadijagan Dental Center. You'll be able to get it right within your community. And that's what this whole trust is about, bringing health closer to people so that they can become more accessible. And once it's accessible to people, we want to ensure that people utilize these services. Don't wait until you're getting sick. You can also do preventative medicine by coming and getting a checkup, and so that we can pick up things before it becomes a complication. So with those words, I want to thank all of you who came out, and we look forward to partnering with the city, partnering with the community, so that we can deliver these health services. Thank you very much.